Good afternoon, ladies and gentlemen, and welcome to Let's Chat with Dr. Celeste D. I'm your host, Dr. Celeste Reese Willis. I'm your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for their acute and chronic medical needs through my virtual medicine program as well as my concierge medicine program. Good afternoon, ladies and gentlemen. I wanted to hop on to apologize to you guys about the mix-up. We're supposed to be live on CBS News today, and we were able to hook it up so that we could see each other, but we couldn't talk to one another, so we wouldn't be able to hear each other. So they tried to work out those difficulties, including us trying to do a Facebook Live, but we could not get that in. And part of the reason we were doing it by Facebook and Skype is because we were really, at this point, really focusing on social distancing. So I wanted to hop on. That's the topic, or one of the things that we're going to talk about, as well as some of the things going on with the testing and some other events and things that have happened today. Hi, Miss Charlene. Thanks so much for joining. Hey, Tamara. Thank you for joining. So I wanted to just hop on for a minute to talk about the social distancing and talk a little bit about the reasoning why. Remember, ladies and gentlemen, this is what's going on right now with COVID-19. Is a very rapidly changing and evolving situation both in our country and in our communities. So literally every day we are made aware of better information that helps us to take better precautions to decrease the spread of this disease. And so just in the last 48, 72 hours even, I would say, a lot of the cases that, or tests rather, that have come back positive. And in addition to that, some of the things that we're learning and other information that we're getting from different things that have gone on in other countries around the globe help us to format, what we're going to do here. We have been providing you information that's directly from the CDC. And I will tell you right now that they still hold the guidelines. I just checked before I got ready to hop on with CBS News to make sure we had the most up-to-date information. And at this point, there are over 3,400 cases that have been reported in the United States, as well as a number of hundreds of deaths that have occurred thus far. Now, at this point, the state of Alabama has reported 22 positive cases. That may not include the latest numbers as of today. I will share with you personally in my speaking with some colleagues and finding out some other information. There are about 5 different cases that I know about that were positive today from at least 3 different resources or 3 different clinic places in 3 different cities actually throughout the state that were positive. So don't let this alarm you in this sense. The more we test people for it, the more positive values that we find. One of the things that is concerning for us, though, is that we're limited in the number of tests. Now, as I understand it, and I spoke with someone today that's from LabCorp, which is one of the major labs that's here in the state of Alabama, and she reports that they expect to be getting more testing in next week. I've had some questions as to, well, Dr. Celeste, why is it that some people can go through and get the drive-through tests, and they find their results in 24 hours, and I was tested at my clinic and it may take a few days? Well, the difference is because that there are different kinds of testing. One of the things that they're coming up with, there's a rapid DNA test or RNA test. It's actually an RNA test, and I don't mean to get too scientific with you, but that is a newer test. The one that's going through the drive-through is the one that's being sponsored by the Church of the Highlands, I believe, is what we call a PCR test, which is a very specific test that literally tests according to the DNA or the viral makeup of the makeup of the virus. I'm sorry. So because it's a difference in the way that they determine that the virus is present, there's a difference in how quickly you get those results back. Now, what that does mean is that there are not enough tests at this point, and doctors that are on the front line, I know that I do some locums work at a urgent care facility that's in the southern part of Alabama, a few days out of the month, and some of the things that we're seeing in the clinics is that there is not enough tests that are available to begin screening persons. And so for that reason, the CDC still has it based that the people that will be tested or tests will be run through. So you can go to a clinic, and even if someone says, okay, I'll flip a little bit and let you, go ahead and do the test, which for the most part, no one's going to do that. There's a very set guideline, but if you're not exhibiting symptoms of fever, cough, or shortness of breath, or haven't had recent travel or known exposure to someone that's positive for COVID, then they may not screen you. If you're an older person that meets a certain criteria, you may get a screening, but that is a limitation. It's because there are not enough testing supplies that are out. We're being told that there will be more tests that are available soon, but this is part of the reason, ladies and gentlemen, why the social distancing is so important. Now, the guidelines on the CDC right now say, cancel any event that's more than 50 people throughout the United States. It said to limit any events or meetings that require close contact and assess your community needs. Now, I'd like to take that a step further. I know we've talked about social distancing, making sure you keep that 6 feet away. My standpoint on it at this point is a lot different even than it was 48 hours ago for this reason. There's a lot that we don't know about it, and we know that it's possible to be spread prior to the person presenting with symptoms. Well, as we're screening, we're finding that there are more and more people that are actually positive for it. So for that reason, the level or intensity of social distancing is very important. I think that they've actually already instituted that soon they will start to close restaurants and bars. We definitely don't recommend that you go out and eat in restaurants. And I know that's a lot different than what was said maybe 48 hours ago, but we're not recommending that at all. If you are, I personally recommend that everyone stay at home and stay safe. Cook your meals at home. If you're someone that has to go out because it's an essential thing, if you have to go out for work, practice the precautions that we've talked about in terms of hand washing. If you are sick, please do not go around other individuals. Please make sure that you see someone in consultation, preferably by telemedicine or telehealth. That is a service that I offer. With my virtual medicine practice, there's several physicians that are offering that service. Check with your physician and find out, if they offer that service. If you need to consult with me, I'm more than happy to see you. But I really want to encourage you guys, especially with the social distancing. Now, I know that everyone has to go out and get supplies to be able to stay inside for 2 to 3 weeks, right? So when you're going out, still practice that social distancing. And I had a colleague of mine, Dr. Jaquel, who actually she suggested that we use the term physical distancing so that people would know, hey, look, we mean for you to physically stay that far away from someone if you have to go out. This is not the time to have gatherings at the house or to have gatherings or parties of individuals. And I would even suggest, if it's more than a group of a couple of people, we shouldn't be meeting each other at each other's houses. Let's talk to each other and use technology on FaceTime or Skype or use these other measures. I know that we miss people we want to, and it really doesn't sound great to be stuck inside your house for 2 weeks, 2 to 3 weeks. And in actuality, guys, it could be longer than that. But whatever measures that are put in place by the CDC and the other health officials that are guiding us through this pandemic, I encourage you to follow those. Now, that would include but not be limited to, we shouldn't be going out to restaurants and bars. We should not be having play dates at each other's houses, especially since we know that there's a virus out there that can spread before someone is passing symptoms. So for that reason, very important to stay at home. They're saying gatherings no more than 10 people. I encourage you guys to have gatherings of your family and yourself at your home. That is what I would recommend that you do at this point. A lot of the information is changing and evolving, and there's a lot about this virus that we don't know. We're watching what's happening in Italy. We're watching what's happening in China, trying to get a good idea of what's going on here. And although we definitely have a lot better technology here than some of the countries do outside of the United States, so we're at an advantage and we're blessed in that way. But I do think it's very important that we do our part. Because we cannot detect the virus and people are asymptomatic, it's very important for social distancing. I was supposed to go into CBS News today to do an interview. They asked me to come in and do one live. I was practicing social distancing, so I did not want to go in. So that's part of what happened with us trying to get things going early. We just couldn't get it to work with the Skype and the FaceTime, so it couldn't work. But part of me doing that is because of social distancing. In other words, not going to leave unless I have to go work and see patients and help out on the front lines and helping to evaluate to hopefully try and keep all of you guys safe. We have personal protective equipment that we need to use. If you have personal protective equipment at home and you are not a physician or a nurse practitioner or a nurse or a medical, if you've somehow gotten your hands on it, I encourage you to either take it back where you got it from and or sell it or, donate it to someone even, because what we don't want is to have our healthcare workers and the people that are on the front lines not being able to take care of you. Help us out by staying at home. Even in situations, especially because things are so evolving and there's so much that we don't know due to the decreased number of tests, or the fact that we don't have enough tests to even test as many people as we want. We as physicians cannot do screening. And what screening is when we test people that are asymptomatic for a disease. We're not able to do screening tests. This is a disease that we suspect is passing prior to you developing symptoms. So we can't screen for that. So the way that we help each other is to stay at home, in our homes, only those essential things. If you got to go out, go out to the grocery store, make sure that you practice hygiene, wash your hands before, wash them after, go get your groceries, come back. When you're out at the grocery store, practice social distancing. Don't sit right up behind someone in the grocery store line. I don't recommend that you do that with us not knowing as much as we don't know about this virus and it evolving and it definitely showing that it is definitely lethal viral pathogen. And until we know more about it and know more how to get a better handle of it, then that is what we should do. So in the next few weeks, you may be told, and I know that this is an uncertain time. I know that, we've never heard of anything like this before when we're being quarantined to our homes. A lot of the efforts that they are putting in place by the government they're putting them in place so that we can try and to protect ourselves as well as your healthcare workers, because as you've seen stories across the nation about healthcare workers that are becoming infected with the virus. And some of that is because a lot of people that have it, unfortunately, have been asymptomatic. And so therefore we suspect that they've been asymptomatic. Let me say it that way. So we suspect that it's been spreading before people develop symptoms. That's pretty much all I had to say. They are right now, some of the recommendations are that if you have no COVID in your community, stay at home if you're sick. You can have meetings of up to 50 people. I personally don't recommend that at all. I don't think people should be holding any meetings or events. I think that everything should be put on hold unless those things that are essential, things that have to take place for us to be able to make it from day to day. And one of those things is providing healthcare, which is something that we do here. So I encourage you guys to do that. Still practice those same basic things that we talked about in terms of staying home if you're sick, making sure that you find someone to be tested through, whether that's do a telemedicine visit, whether it's with me, whether it's with your physician, whether it's with another health system. Definitely do that telemedicine visit. If you have regular appointments, I would ask you to call your physician and find out. I will share this with you. One of the things that I love that I saw today was a physician's office that they ran a drive-through when they're preventing, and I actually spoke with the head of another urgent care center, and they are talking about, the discussion dealt with the best way to try to deal with patients, and one of those things is trying to triage the patient at the site of the door before patients even go into the clinic to try and figure out, hey, are you sick? Then we may need to screen you outside. So I know it may seem kind of, they're screening and swabbing my nose outside. Don't be offended by that. We're trying to decrease the risk of it spreading. And one of the ways that it's going to help to do that is if people that are sick are screened outside, then they're not inside the clinic where other people that are trying to receive other medical services that they need are, so that helps to decrease the risk. So, and that, ladies and gentlemen, that's all I have. I don't know if anyone has any questions. I'll be more than happy to answer those. If you have a question, you can leave it in the chat. We will try and keep you updated as much as we can. Hey, Lewis, thanks so much for joining. Hey, Jocelyn, thanks so much for joining. Hey, Natalie, thanks so much for joining. Hey, Michi, thanks for joining. Hey, Mr. Harbin, thanks so much for joining. So that's all I have. If no one has any other questions, please feel free. If you want to book a telemedicine visit with me, please visit my website at drcelestemd.com. That's DOCTORCELESTEMD.com. If we are trying to get some more information and having some more updated information actually active on my website. So we're going to work on that for the next couple of days. And sorry about the interview with CBS News today. We couldn't get the Skype and the FaceTime to work at the same time. So, but we'll probably try and get that together at another time. Hey, Mishi. Oh, you're so welcome. You're very welcome. More than happy to help keep us updated. And you guys that are out there in healthcare, please be safe. Please wear your PPE. Please wear your PPE, y'all. Oh, and I forgot, most importantly, guys, if we don't do anything else, let's join together in prayer to God, because He's the ultimate healer. He blessed us with this medical knowledge. He blessed us to be able to be here and provide healthcare services to you guys. And I do personally believe that that's why He put me here on earth, is to provide medical services and help improve the healthcare of other people and to service His people in healthcare. And so I think that we should all pray for that. God didn't give us a spirit of fear. His word says that. He wants us to look to Him for direction and for healing. And I just pray that He gives us everything that we need to help to mitigate the risk and decrease the spread of this virus and help keep as many of us healthy, safe, and well. Okay, with that, ladies and gentlemen, good night. Have a good night. And let's all pray to God for His help. Thank you, Lord. Amen.